The majority of people experience low back pain in their lifetime, and the goal of our research is to try and create alternative treatments for this pain. One of the current conservative treatments for low back pain is opioid prescriptions. So obviously the opioid epidemic is a huge problem in the United States and one that we're trying to overcome. So our treatment looks to deliver local therapeutics to the site of pain as opposed to a systemic treatment that's taken orally, and so this would circumvent the need for opioids altogether. One of the major causes of low back pain is you can actually get sprouting of the nerve fibers that are adjacent to the disc into the disc itself. And so when these painful nerve fibers sprout into the disc, they can actually cause low back pain. And so our research seeks to treat this pain by understanding what causes this growth into the disc and how can we prevent it and reverse it. Our approach is unique in that it uses materials that are neuroinhibitory or block nerve growth, in addition to drugs that cause nerves to die back. And so by this combinatorial approach, if we have nerve fibers that have sprouted into the disc, we can treat them with our therapy and it will cause the nerves to die back and prevent regrowth, thereby eliminating the pain. The material we're using has actually been identified in spinal cord injury to prevent nerve growth. So it's a material that we're sort of repurposing for use in the disc to prevent nerve growth in an area that shouldn't have nerves.
So this is a cluster of sensory neurons.
It's really important to share this research with the local community around us. And so two ways that we're doing this is we're partnering with the Osher Lifelong Learning Institute to create some coursework around low back pain and orthopedics. And we're also incorporating communication of science into our classroom. And to do this, we're actually using TED Talks to enable the students to learn how to communicate their science to broad audiences.
It's cool to work at a project like this in our lab because the work that we're doing on our benchtop could potentially change someone's life forever.
So when a patient is diagnosed with this type of low back pain, they'll be able to have a minimally invasive surgery that will deliver this drug and therapeutic to cause nerve dieback and prevent regrowth, thereby reducing their pain. With support from National Science Foundation, we're really excited to do this research that has the potential to impact millions of patients around the world.